LASIK is a surgical procedure used to correct near and far-sightedness. It is often seen as a last resort option when glasses and contact lenses lack efficacy. The most common question is, can you get LASIK twice? The answer is yes. LASIK can be used again, but it's important to understand the risks and the possible outcomes. Depending on your individual needs, LASIK can be used more than once for certain vision-related conditions. Before considering a second LASIK procedure, it's important to understand why the first procedure was unfinished. Any corrections to the first procedure must be addressed and fixed before attempting a second one. If your existing refractive error, such as nearsightedness or astigmatism, has increased since your first procedure, you can get a second LASIK to correct the difference. It's important that the correct initial power and the lens shape are considered in the final results. Another cause for a second LASIK is regression. In this case, the patient had technically achieved the desired outcome with the first procedure, but the results have changed over time. Regression is caused by normal aging processes and often results in vision changes. The cause of the regression must be determined before attempting another procedure. Sometimes, LASIK can be performed if the eye is no longer responding to glasses or contact lenses. LASIK can also be used to address an interfering condition during a previous procedure. Before considering a second LASIK, it's important to understand that the risks are increased with multiple surgeries. This is why it's important to be assessed by a specialist. Your eye surgeon should be able to assess your eyes and determine the most suitable options for you. There are also certain safety guidelines, such as a waiting period of at least 6 months before attempting a second LASIK. It's also important to consider the chances of a successful outcome. A secondary LASIK surgery is more likely to be unsuccessful since the risk of complications is higher. In some cases, results from the first procedure may not be enough to achieve the desired outcome. In this case, further surgery may be necessary to reach the desired results. Another factor that affects the success of a second procedure is the age of the eye. Generally, younger eyes are more resilient and better suited for a second surgery. LASIK is a safe and effective procedure, but the decision to get a second procedure should be discussed with your eye doctor. It's important to take into account your eye condition and desired outcome when considering a second procedure. If the risks are accepted, a second LASIK procedure can be performed. Generally, the procedure itself is the same as the first one, with some alterations made to the patient's eyes. Post-operative care is also important, as it allows the eye to heal properly and reduces the chances of complications. Your surgeon will provide you with post-operative care instructions before and after the surgery. After a LASIK procedure, it's important to avoid rubbing and touching your eyes to reduce the risk of infection. You should also rest and allow the healing process to take place. In general, LASIK can be used twice, but the risks increase with each procedure. It's important to consider the risk factors and understand your personal situation before attempting a second LASIK procedure. A a specialist will be able to better assess your eyes and provide more detail on how a second LASIK procedure can benefit you. In some cases, additional treatments may be recommended instead of a second LASIK. The chances of successful outcomes also depend on the amount of time since the first procedure. Generally, the longer it's been, the easier the second procedure will be. Additionally, it's important to ensure the correct follow-up is conducted to avoid any potential complications. Each person's situation is different, so be sure to get the advice of a specialist. It's also important to consider the cost of a second procedure. It's common for insurance to cover the cost of a second procedure, depending on your current situation. LASIK can be used twice, but it's important to understand the risks and potential complications. It's recommended to speak to a specialist before considering a second procedure. Age also plays a part in the success of a second procedure. Generally, younger eyes are more likely to respond to the procedure. Another factor to consider is any pre-existing conditions that may interfere with the healing process. If your doctor has deemed it safe to proceed with a second procedure, then it can be performed. After a second procedure, it's important to follow the prescribed post-operative care instructions. The eyes should be rested and not be put under any further stress.